Hey everybody, how you doing? This is Brad, and I am doing a video series on my upcoming knee replacement surgery. Why I'm doing this is twofold. I've seen people do this on YouTube, and it helps other people, including me. I'm hoping me documenting this helps you, and it's also to help me see my progress and see how far I've come and what I'm feeling and what I'm going through with this surgery. I want to start by saying I'm 55 years of age, and I'm guessing about 4 or 5 years ago I fell on my deck. I'm on the second floor here in my apartment. I have about 16 steps, and one day I fell on the top step and I boom right on my knee really hard, and I thought I broke it. It felt bad. So I go to urgent care here on Shrewsbury Street. They do x-rays and they say, good news, nothing's wrong, you didn't break anything. I'm like, great. Meanwhile, my knee is the size of a small watermelon. Come to find out, there's something called a bursa around the knee. It's some sort of a protective thing. And I broke it. The blood comes out, makes your knee all red and swollen, but no break. So let's see, a couple weeks after that, I go to the beach with my friend Mark, and he's like, you better get your leg checked. And I'm like, why? He goes, look it. So I turned around, and near my ankle, all blood, like red, black, blue. And I said, what the hell is that? I didn't hit my ankle. I didn't think it was related to my knee. So off to the emergency room I go, and the doctors are looking at it and they say, did you recently fall? And I said, yes, I did. Well, when you hit your knee and the blood drains, gravity pulls it down to the end of your leg. So here I am freaking out, seeing all this discoloration, thinking it was something much worse than it was. And it was just the residual blood from my knee. It drains down, gravity down to the knee, and it will go away, and sure enough it did. So let's see, it was about 4 years ago, maybe 5. I'm 55, not much before then. So we go up to about 6 months after that, and my knee is hurting. And it felt better, and now it's hurting. I'm going, what the heck's going on? Why is it hurting again? And my primary says, you better go see an orthopedic guy. Knee guy. So I said I did. They look at my x-rays, or I bring my x-rays from Reliant from when I went to the urgent care meeting, and they said, did they tell you have arthritis? I said, no, I didn't know I have arthritis, and you do. And the x-ray, I don't know if you've ever seen it, but you've got top part of your leg, femur or the tibia or something, and you got the bottom part of your leg and the joints in the middle, and you've got some space there where your kneecap is, also called the patella. And that space has a coating called cartilage. And if you're athletic, or as we get older, it's a weight-bearing joint, and that cartilage starts to dissipate, and now the bone on bone is touching, and it causes arthritis, and it causes pain. Oh boy. Oh boy. Why is it oh boy? Because I remember my father having knee arthritis for years and didn't do anything about it. Probably didn't do anything about it because A, he didn't understand the technology. He's remembering what his father went through, because I remember my grandfather being in the hospital for 2 or 3 weeks, resting for 4 or 5 months, not able to drive, nothing. So he's probably thinking of that. So I'm at the doctor's office, and what do we do? Well, you get cortisone injections. And I've had cortisone injections before, so it's no big deal to me. So we start with the injections in the knee. Not the most pleasant thing. Kind of a weird pain. It's a pain. There's a long needle. I mean, it depends on your tolerance level, your pain tolerance level. Certainly bearable, but weird, at the very least. And with cortisone, it takes about 4 days before you notice the effects. And 4 days later, walking around, and it did a tremendous job on the pain. I would say the pain was, God, more than 95% gone. Almost couldn't tell anymore. And again, everything I say here is up for negotiation. Everyone's pain tolerance, everyone's progress is different. So I'm just telling you what my experience is. So I got the cortisone injections. You can get them every 3 months, I believe. Wore off, went back, had some luck. Now it's maybe year 2. Not working as well. By the end of year 2, I'm like, doctor, I went to Dr. Vinton and Dr. Leahy. It's Worcester Orthopedic here in Worcester. It's not working. It's not working much anymore. Well, there's something else we can try. It's called a gel injection. It's made from the rooster comb, the comb of the rooster, that red thing. And the brand name, I believe, is Simvastic. I think it's called Simvastic, but there's different, brand name generic. It's a gel injection, and it can sometimes work, not all the times, it can work better than the cortisone. Not always guaranteed. I had some good luck with it. So with these injections, you can only get them there's 3 sets of injection, spaced a week apart, series of 3, and then by the 3rd injection, you have to wait 6 months before you can do it again. That worked great. Definitely picked up where the cortisone stopped. 2 rounds, maybe 3 rounds of that. Now we're in year 3, maybe close to year 4. Oh no, no longer working. Doc, the gel's not working anymore. Brad, it may be time to see a knee specialist. Now, they are a knee specialist, but he preferred me to a Dr. Balcom. Does more non-sports related injuries. I think Vinton and Leahy prefer the 35 athletic. I'm neither. So he recommended I go see Dr. Balcom. Scared to death. I have an anxiety disorder. Scared to death. As soon as he comes in, you need a new knee. Oh my God. I have an anxiety disorder. I'm scared, but there's a reason also I want to talk about, which I had a procedure called a cystoscopy. About 3 years ago when I went in, I had a little bit of microscopic blood in my urine. So what they do is there's a procedure where they go through the front into your bladder, and they look around because microscopic blood, now you can't see the blood when you urinate, microscopic, but that can be a sign of something serious. It's my understanding it's usually not. And thank God, I've had several of these, it's not. I guess as men get older, the bladder expands and there's little tiny blood vessels in there, and those blood vessels can leak and you get little microscopic blood in the urine. And that's what they feel is my case. Also, if you exercise a lot, people that run a lot, they're moving their insides a lot, you can break a blood vessel. It just happens. It's nothing serious. It just happens. But it can be a sign of something more serious like cancer or something like that. So they just want to make sure. So I go into for the procedure, and I've had several before, but none like this. Went in for the procedure, and when I was intubated, we're assuming, I don't know for sure, I was cut. Why? I go in, I'm intubated, now they leave me for a few minutes until the surgeon comes in. He comes in, and he's looking, and he goes, "What's all the blood in Brad's mouth?" I've got all blood. So he never did it. They don't know where the blood's coming from, so they kept the tube, the intubation in place. They didn't want to remove it to possibly cause more damage. Go to ICU. So I go in one day, and 3 days later, I wake up in ICU. I was totally intubated the whole time, totally on propofol. I wake up, I got a beard. I couldn't call work. I was out of it. I lost like 4 days of my life. My father's at the house. I have a dog. Dog's still here. I have a dog. Couldn't take care of the dog. Thank God for family and friends, because my friends and my family came up. They checked on me, and I was okay. I mean, it could have been worse, but they didn't want to remove the tube, and then they eventually removed the tube. They did all kinds of scans and everything. And to this day, we still don't know what happened. We do not know what happened. So that's in the back of my mind. I mean, I don't think anybody likes surgery, but some people might like it a lot less, and I'm one of those people that like it a lot less, especially with anxiety. So I'm at the doctor's office, Dr. Balcom, going back to the orthopedic guy, and so I'm thinking back to my grandfather, 2 weeks in the hospital, 5 months recovery, can't drive. Oh my God. I said, Dr. Balcom, I don't know what to do because I will not go in the hospital for 2 weeks. I have to drive for work. I'm in insurance sales. I got to drive, although currently we're in a pandemic. I said, I got to drive to my clients and I can't wait 6 months. And he's like, what are you talking about? He goes, 2 weeks? He goes, if you're 35 and athletic, which again I'm not, it's done the same day. For everyone else, for most people, it's one night in the hospital. I'm like, oh. He goes, most people drive within a few weeks. So, bottom line is the surgery's changed quite a bit from 40 years ago when my grandfather had it done. And again, I think my father was reverting back to my grandfather. And let's just say 40 years ago there's a lot has changed, especially in surgery. So, I don't want to talk too much in this video. I'm doing a series of these videos. I'm almost done. So we decided on the date for the surgery, first week of April. Boom, the pandemic hits. Everything is stopped. No surgery, no elective surgeries, nothing. COVID's running rampant. I'm like, great. Now at the time, in April, my pain was about a 5 or a 6, tolerable, but certainly painful, and it stopped at night. And the doctor did say eventually it will get worse, and let's see, April, now along comes late June, early July. Getting out of bed takes about 10 or 12 minutes, all stiff, extremely painful. Walking 15 feet, killing me. Bone on bone, no cartilage, hurts. So I heard recently that the elective surgeries are back, starting again, so I called. I know I have to get it done. So now they've decided that they're going to do it on August 26th, which is just 2.5 weeks away. And that's it. So this is part 1 of my video series of my knee journey. I will pick up on this probably next week. I'm going to talk about pre-testing. I'm going to talk about success rate, talk about things that you should be prepared for knee surgery, replacement surgery, probably any surgery. And I'll continue that on my next video series. So that's it for now. Thank you for taking the time to watch and to listen. And I'll be back with my knee journey 2 next week. Thank you.